If you're over 50 and you're dealing with frequent urination, weak stream, urgency, getting up multiple times at night to pee, or that feeling like you can never fully empty your bladder, you've probably been told it's just aging and there's nothing you can do about it except eventually take medication or consider surgery. But what if I told you that 3 common daily habits you're doing right now are directly contributing to your prostate enlargement, and that if you change these habits, you can actually reduce inflammation, improve your symptoms, and restore comfort without any medication at all? And I'm Dr. Melinda Wright. I'm a urologist who spent over a decade helping men understand and manage prostate health. And I'm going to break down exactly what these 3 habits are, why they're destroying your prostate, and what you need to do differently starting today. Your prostate is a small gland that sits right below your bladder and wraps around your urethra, which is the tube that carries urine out of your body. When your prostate is healthy and normal-sized, urine flows freely, and you don't think twice about it. But when your prostate enlarges, which is what happens with benign prostatic hyperplasia or BPH, it starts squeezing that urethra like a hand gripping a garden hose. The result is all those annoying symptoms: weak stream, difficulty starting urination, frequent trips to the bathroom, urgency, incomplete emptying, and nighttime disruption. Now, conventional medicine will tell you this is just what happens as you age. Your prostate naturally enlarges because of hormonal changes, specifically the conversion of testosterone to dihydrotestosterone, or DHT, which stimulates prostate tissue growth. And while that's true, it's not the whole story. What most doctors don't talk about is how your daily habits create an environment of chronic irritation, inflammation, and pressure that accelerates prostate enlargement and makes symptoms much worse than they need to be. When you address these habits, you can significantly slow or even reverse some of the enlargement and definitely improve your symptoms. Let me walk you through the 3 habits that are quietly sabotaging your prostate health every single day, and then I'll give you the practical solutions that actually work. The first habit is delaying urination. This is huge, and almost every man does it without thinking twice about it. You feel the urge to urinate, but you're in the middle of something. You're watching TV, you're driving, you're in a meeting, so you hold it. You tell yourself you'll go in a few minutes when it's more convenient. Then a few minutes turns into 15 minutes or half an hour, and by the time you finally get to the bathroom, your bladder is uncomfortably full and you're desperate to go. Here's why this is a disaster for your prostate. When your bladder fills beyond its comfortable capacity, it expands and pushes down on your prostate. Your prostate sits right underneath your bladder, so when that bladder is overfull and distended, it's literally pressing on the prostate tissue, compressing it, creating pressure. At the same time, because your prostate wraps around your urethra, the urethra itself is being compressed from the outside by the enlarged prostate and from the inside by the pressure of the overfull bladder trying to force urine through. Think of your prostate like a sponge. When you squeeze a sponge repeatedly over time, it doesn't just bounce back to its original shape perfectly every time. It starts to stiffen, it loses some of its elasticity, it gets a little bit compressed and distorted. The same thing happens to your prostate when you repeatedly subject it to this pressure from holding your urine. The tissue becomes irritated, it swells in response to that irritation, and over months and years, this chronic irritation contributes to permanent enlargement. On top of that, when you finally do urinate after holding it for too long, you're forcing your bladder muscles to work extra hard to push urine through that compressed urethra. Over time, this strengthens the bladder muscle, which sounds like a good thing, but actually isn't. The bladder muscle becomes thickened and less elastic, kind of like how a bodybuilder's muscles get big but tight. A thickened bladder wall is more sensitive and more prone to urgency and frequency. So you end up in this vicious cycle where holding your urine causes prostate irritation and bladder changes that make you feel like you need to urinate even more frequently. The solution is simple but requires a mindset shift. Stop delaying urination. When you feel the urge, especially that first gentle urge, respond to it. Don't wait until you're desperate. Go to the bathroom when your body is telling you it's time. This keeps your bladder from overfilling, it reduces the pressure on your prostate, and it prevents that cycle of irritation and inflammation. I know what you're thinking. If I go every time I feel a slight urge, I'll be in the bathroom constantly. But here's the thing, when you start responding to your body's natural signals instead of overriding them, your bladder actually starts to function more normally. The urgency decreases because you're not constantly triggering that panic response from an overfull bladder. Your prostate has a chance to calm down because it's not being repeatedly compressed. Over time, you'll find that you're going to the bathroom at reasonable intervals without the desperate urgency you're experiencing now. The second habit that's destroying your prostate is ignoring constipation. Most men don't realize there's any connection between their bowel habits and their prostate, but the connection is direct and significant. Your prostate sits right in front of your rectum. They're separated by a thin wall of tissue, but they're basically neighbors. When your rectum is full of hard, compacted stool because you're constipated, that stool is pressing directly against the back of your prostate, creating constant pressure and irritation. But it's even worse than just mechanical pressure. Constipation creates systemic inflammation throughout your body, but especially in your pelvic region. When stool sits in your colon for too long, it becomes a source of toxins and inflammatory compounds that get absorbed into your bloodstream. Your immune system responds to this by ramping up inflammatory processes, and that inflammation affects all the tissues in your pelvis, including your prostate. Chronic low-grade inflammation is one of the primary drivers of prostate enlargement. When your prostate tissue is constantly inflamed, it swells, it becomes more sensitive, and over time it undergoes structural changes that lead to permanent enlargement. By keeping yourself chronically constipated, you're bathing your prostate in inflammatory signals day after day, year after year. And here's what's causing constipation for most men: low fiber intake, high consumption of refined carbohydrates and processed foods, insufficient water intake, and lack of physical activity. The standard American diet is a recipe for constipation: white bread, pasta, rice, processed snacks, fast food, not enough vegetables, not enough fruit, not enough whole grains. Your digestive system struggles to move this food through efficiently, and you end up with hard, dry stools that are difficult to pass. The solution is to dramatically increase your fiber intake and improve your overall diet. You should be getting at least 25 to 30 grams of fiber per day, and most men are getting maybe 10 to 15. Fiber adds bulk to your stool and helps it move through your digestive system smoothly. It also feeds the beneficial bacteria in your gut, which supports overall health and reduces systemic inflammation. Good sources of fiber include vegetables, especially leafy greens, broccoli, Brussels sprouts, carrots, and sweet potatoes. Fruits like apples, pears, berries, and oranges. Whole grains like oats, quinoa, brown rice, and whole wheat. Legumes like beans, lentils, and chickpeas. And nuts and seeds. These foods should make up the bulk of your diet, not occasional additions. You also need to drink enough water. Fiber without water can actually make constipation worse because the fiber absorbs water from your digestive tract. You need adequate hydration for the fiber to do its job properly. Aim for at least 8 to 10 glasses of water per day, more if you're active or it's hot outside. And if you're dealing with chronic constipation right now, you may need some additional support while you're transitioning to a higher fiber diet. Magnesium citrate is a gentle, natural supplement that helps draw water into your colon and soften stools. Start with 200 to 400 milligrams before bed and adjust based on your response. Prunes or prune juice can also be helpful because they contain natural compounds that stimulate bowel motility. And consider a good quality probiotic to support your gut bacteria. The goal is to have a soft, easy-to-pass bowel movement at least once a day, ideally in the morning. When you achieve this, you'll remove that chronic pressure and inflammation from your prostate, and you'll notice a significant improvement in your urinary symptoms. If you're finding this information valuable, hit that subscribe button because I create content like this regularly that gives you practical solutions to men's health problems. Drop a like if this is helping you, and share this with anyone dealing with prostate issues. The third habit that's sabotaging your prostate is prolonged sitting. This is a massive problem in modern life, and most men don't realize how much damage it's doing. You sit at your desk for work, you sit in your car during your commute, you sit on the couch watching TV or using your computer at home. You might be sitting for 10, 12, 14 hours a day with very little movement in between. When you sit, especially for extended periods, you're compressing all the tissues in your pelvis. Your body weight is pressing down on your prostate, your bladder, your pelvic floor muscles, and all the blood vessels and nerves that supply this region. This compression restricts blood flow, which means less oxygen and fewer nutrients are reaching your prostate tissue. It also impairs lymphatic drainage, which is how your body clears metabolic waste and inflammatory compounds from tissues. The result is a perfect environment for inflammation and tissue damage. Your prostate is essentially starved of the resources it needs to stay healthy, and waste products that should be cleared away are sitting there causing irritation. Over months and years, this chronic low-level damage contributes to prostate enlargement and worsening symptoms. On top of the mechanical compression, prolonged sitting is associated with metabolic dysfunction. It impairs insulin sensitivity, it promotes weight gain especially around your midsection, and it increases systemic inflammation. All of these factors independently contribute to prostate problems, and they all get worse with excessive sitting. The solution is not to quit your job or stop driving. It's to interrupt prolonged sitting with frequent movement breaks. I call these movement snacks, and they're exactly what they sound like: small, frequent bursts of activity throughout the day that keep your circulation moving and prevent that chronic compression and stagnation. Here's what this looks like practically. Set a timer on your phone or your computer for every 45 to 60 minutes. When that timer goes off, stand up. Walk around for 2 to 3 minutes. It doesn't have to be vigorous exercise. Just walk to the bathroom, walk to get some water, walk down the hall and back, whatever gets you on your feet and moving. This brief interruption is enough to restore circulation to your pelvis, allow blood and lymph to flow properly, and prevent that accumulation of pressure and waste products. If you can, add in some simple stretches or movements that specifically target the hips and pelvis. Hip circles, gentle squats, leg swings, anything that moves your pelvis through different ranges of motion and activates the muscles in that region. This further enhances circulation and keeps the tissues healthy and responsive. And if you're able to, replace some of your sitting time with standing or walking. Use a standing desk for part of your workday. Take phone calls while walking instead of sitting. Park farther away from entrances so you have to walk more. Take the stairs instead of the elevator. These small changes add up to significant increases in daily movement without requiring you to carve out hours for the gym. I had a patient, Kenneth, who came to me at 57 with severe urinary symptoms. He was getting up 4 to 5 times every night to urinate. He had constant urgency during the day, weak stream, and he felt like he could never fully empty his bladder. His quality of life was terrible. He was exhausted from the interrupted sleep. He was anxious about being too far from a bathroom, and he was seriously considering medication or surgery. We talked about these 3 habits. He admitted that he routinely held his urine for hours because he didn't want to interrupt his work. He was chronically constipated, going maybe 2 or 3 times a week with hard, difficult bowel movements. And he was sitting 12 to 14 hours a day between his desk job and his evening routine at home. I gave him the same guidance I'm giving you. Stop holding your urine. Go when you first feel the urge. Increase fiber dramatically. Add more vegetables and whole grains. Drink more water and take magnesium citrate at night. And set a timer to get up and move every hour during the workday, plus add a 10-minute walk after dinner each evening. He was skeptical. He didn't think these simple changes could make a real difference, but he committed to trying for 2 months. Within 3 weeks, he was only getting up twice a night instead of 4 or 5 times. His daytime urgency had decreased noticeably. By 8 weeks, he was sleeping through most nights without waking to urinate at all. His stream was stronger, he felt like he was emptying more completely, and his anxiety about bathroom access had disappeared. He told me he felt like a different person, and he couldn't believe that such basic changes had made such a dramatic difference. Another patient, Deshaun, was 52 and dealing with moderate symptoms. He wasn't as severe as Kenneth, but he was frustrated with having to get up once or twice a night and dealing with urgency and frequency during the day. His primary issue was constipation. He was eating terribly, lots of fast food and processed junk, almost no vegetables or fiber, and he was sitting all day for work with no movement breaks. I focused him on the diet and movement changes. He started meal prepping on Sundays, making big batches of vegetables, grains, and lean proteins that he could grab throughout the week. He added a probiotic and magnesium, and he started taking a 15-minute walk during his lunch break and getting up every hour to move around his office. Within a month, his bowel movements had normalized to once a day, soft and easy. His nighttime urination dropped from 2 times a night to once or not at all. His urgency decreased significantly. He also lost about 8 pounds, and his energy improved dramatically. He said the changes were so obvious that he couldn't imagine going back to his old habits. These stories aren't exceptions. This is what happens when you address the root causes of prostate irritation instead of just trying to manage symptoms. You're not just masking the problem, you're actually changing the environment in your pelvis, reducing inflammation, improving circulation, and allowing your prostate to function more normally. Now, I want to be realistic with you. These changes aren't going to cure severe prostate enlargement overnight. If you've got a massively enlarged prostate that's causing complete urinary obstruction, or if you've got prostate cancer or other serious conditions, you need medical intervention. These habits support prostate health, but they're not a replacement for necessary medical treatment. But for the vast majority of men dealing with benign prostatic hyperplasia and the annoying symptoms that come with it, these 3 habit changes can make a profound difference. You can reduce your symptoms, improve your quality of life, and potentially slow or even reverse some of the enlargement. And even if you do need medication or treatment down the road, addressing these habits will make those interventions more effective and might allow you to delay them for years. Let me give you a practical action plan because I want you to actually implement this, not just think it sounds like a good idea and then forget about it. Week 1, focus on not delaying urination. This is the easiest habit to change because it's just about awareness and response. When you feel the urge, go. Don't put it off. Pay attention to how your symptoms change over the first week as you stop subjecting your bladder and prostate to that chronic overfilling and pressure. Week 2, keep up with the urination habit and add in the dietary changes for constipation. Start increasing your vegetable and fiber intake. Add a serving of vegetables to every meal. Switch from white bread and white rice to whole grain versions. Add some fruit as snacks. Start drinking more water throughout the day. If you need magnesium or prunes to help with immediate constipation, add those in as well. Week 3, maintain the first 2 habits and add in the movement breaks. Set a timer for every hour, get up and move for a few minutes. Add a short walk after dinner. Start being more intentional about reducing total sitting time. Look for opportunities to stand or walk instead of sit. By week 4, you should have all 3 habits integrated into your daily routine, and you should be noticing measurable improvements in your symptoms. Track your progress. How many times are you getting up at night? How's your daytime frequency and urgency? How's your stream strength? Write it down so you can see the objective improvements. And then continue these habits indefinitely. This isn't a short-term fix. This is a sustainable lifestyle adjustment that supports long-term prostate health. The beauty of these changes is that they're not extreme or difficult to maintain. You're not following some restrictive diet or spending hours at the gym. You're just making simple, common sense adjustments to how you handle urination, what you eat, and how much you move. These are changes you can stick with for the rest of your life. I also want to address some additional factors that can support prostate health alongside these 3 habit changes. Consider adding saw palmetto, which is a herbal supplement that has good evidence for reducing prostate enlargement and improving urinary symptoms. Beta-sitosterol is another supplement that can help. Pumpkin seed oil has also shown benefits in some studies. These aren't magic bullets, but they can provide additional support when combined with the lifestyle changes. Reduce your alcohol and caffeine intake, especially in the evening. Both of these are bladder irritants that can worsen urgency and frequency. If you're drinking coffee all day and having alcohol at night, you're making your symptoms worse. Cut back significantly and see how much better you feel. Manage your stress. Chronic stress contributes to systemic inflammation and can worsen pelvic floor tension, which exacerbates urinary symptoms. Find ways to manage stress daily through deep breathing, meditation, exercise, time in nature, whatever works for you. Maintain a healthy weight. Excess body fat, especially abdominal fat, is a source of inflammatory compounds, and it's associated with worse prostate symptoms. If you're overweight, losing even 10 to 15 pounds can make a noticeable difference. And finally, stay sexually active. Regular ejaculation helps clear the prostate of fluids and may reduce inflammation and congestion in the gland. This is another area where use it or lose it applies. Regular sexual activity or masturbation supports prostate health. Your prostate doesn't have to control your life. You don't have to resign yourself to getting up 5 times a night, planning your day around bathroom locations, or dealing with constant urgency and discomfort. You have more control over this than you've been led to believe. By changing these 3 daily habits, urination timing, bowel health, and sitting patterns, you can significantly improve your symptoms and your quality of life. This is about taking back control, about refusing to accept that decline is inevitable, and about making informed choices that support your body's natural capacity to function well. These aren't difficult changes. They just require awareness, intention, and consistency. Drop a comment and tell me which of these 3 habits you're going to tackle first. Let me know what symptoms you're dealing with. What other prostate or men's health topics do you want me to cover? I read every comment and I create videos based on what you're asking for. I'll do the research and give you the practical information you need. If you haven't subscribed yet, hit that button now. I release detailed, actionable content like this regularly on men's health topics that can genuinely improve your life. And share this video with any man who's dealing with prostate issues, because chances are his doctor hasn't told him any of this. Your best years aren't behind you. Your prostate can function better. Your symptoms can improve. Your quality of life can be restored. It starts with simple, sustainable changes to daily habits that you're completely capable of implementing. The power is in your hands. I'm Dr. Melinda Wright, and I'll see you in the next video.